Hi there, this is Dr. Appel from Ado Psychology Center, where we specialize in treating anxiety, depression, and OCD. For today, I'd like to discuss agoraphobia, which is an anxiety disorder that is characterized by a fear of being in situations where one cannot easily escape or get the help they need if they were to start feeling panic symptoms, such as having a panic attack, or other embarrassing symptoms, such as urinary incontinence. So as you can imagine, those who suffer from panic disorder many times have a comorbid disorder of agoraphobia, because once someone has panic disorder and they're experiencing panic attacks and very afraid of the next one, they may also become afraid of being in situations where they won't be able to easily escape in case they were to have a panic attack. Now, obviously, you don't have to escape a situation just because you're having a panic attack, because panic attacks are not inherently dangerous. In fact, the most important thing for someone to remember who has panic disorder is that when they're feeling the panic attack, it is not dangerous, just uncomfortable. And yet, because it feels so uncomfortable and scary and feels dangerous, someone may be afraid of then being in a situation where they won't easily be able to escape from. So for example, a common example is being on a plane or public transportation or being on a train. Now, this should not be confused with a specific phobia of being on a plane, because over there people are usually afraid of the plane crashing or some other danger related to the plane. Whereas here it's not about the thing itself, such as the plane itself, but rather it's about being in any situation. This should also not be confused with claustrophobia, which is where someone is afraid of tight spaces or small spaces, because someone with agoraphobia might be afraid even in a large mall where you won't be able to find the exit that easily, or even in a desert. So it's not about it being a confined space, it's more about being in any kind of situation where you can't escape easily from. In fact, in order to differentiate between a specific phobia of planes, for example, or agoraphobia, is to ask someone whether they would rather one long plane trip or multiple short ones. Someone with a specific phobia would rather one long one, so there's less taking off and landing, whereas someone with agoraphobia would rather multiple shorter trips where they can escape if necessary each time they land, and they're not necessarily afraid of the plane itself or taking off or landing. I've also had patients who would prefer taking the local train instead of the express train because there are more stops they can get out by, even though ultimately it makes their trip longer. Fortunately, there is an evidence-based treatment for agoraphobia, and within CBT, cognitive behavioral therapy, you can do exposure therapy so that someone slowly starts facing their fears in a gradual manner and also receive psychoeducation and cognitive restructuring in order to help them retrain their brain to think in a healthier way about it and ultimately behave in a healthier way as well. And over time, someone starts then regaining their freedom. Unfortunately, when agoraphobia gets really bad, it can get so bad as someone not being able to leave their home because they feel like everywhere outside their house is too scary. And so it's better to treat agoraphobia earlier instead of waiting for it to get to be at a more severe level. For more information on agoraphobia or other disorders, you can visit our website, which is adopsychologycenter.com. See you there.